Hi, hello, everyone. This is Joaquin Cabezas, who is going to speak regarding this topic. These are my disclosures. This will be my agenda. It seems somehow crowded, but I will try to the point and give you key message in each slide. This slide summarizes the levels that should be included when you design a strategy for hepatitis C elimination regarding the patient level, health system, and the stakeholders level at the top to include what you need to eliminate hepatitis C. Recently, we were able to have an updated recommendations for the goal of hepatitis C elimination by the WHO, and my group also were available to collaborate with the Polaris Observatory to agree with the absolute numbers to track goals for hepatitis C elimination. But what's more important is the part that includes like a dynamic definition of the hepatitis C goals, like the continuous reduce in the incidence of hepatitis cellular carcinoma related to hepatitis C. The cornerstones of hepatitis C elimination in Spain are those that are presented in this slide. The first one is the design of the strategic plan that clearly describes how to manage hepatitis C, prioritize the treatment at the beginning, but what was clearly of paramount importance is the wide availability of the treatment regardless of the disease, the liver disease. And recently, the Ministry of Health has released the guidelines to test for hepatitis C. We can review in detail in the next slides on the QA. And at the scientific level, the Spanish liver for the study of the liver diseases and also the Gastroenterology Society released the recommendations for hepatitis C screening with the aim of elimination at the end of the care cascade. But to eliminate hepatitis C, you have to keep in mind, you have to know about the problem, and these studies updated the epidemiology of hepatitis C. One that was carried out by my group that said it, that set the incidence of hepatitis C in 0.3, and the other one that was promoted by the Ministry of Health when yet was already available the DDA treatment. As you can see, the incidence of active infection is declining. Keep in mind that it's not only about the epidemiology, but also of the model of care. One of the cornerstones for the hepatitis C management was the viability of the reflex tests. This means that with one sample, you can carry out the antibody determination, and for those that test positive, they automatically determine the RNA to detect the active infection. This, in this model of care, was also coupled with alerts for the people to test, and alerts for the specialists to get these people with an active infection. And the other part of the slide is what means that the other things with the other tools we have to test for infection are rapid tests or point of care tests that allows you to have access for a wider population. Remember that every time we test for an active infection, we have to evaluate the disease, the liver disease, to rule out cirrhosis or organ disease. And nicely, we are now doing this evaluation in a one-stop manner that facilitates and improves the linkage to care. My group has the expertise in the management of hepatitis in the correctional setting, where we were able to eliminate hepatitis C in a prison, and now is the model of care widely carried out in our region based on a regular and universal screening, and then quick evaluation to prescribe treatment and evaluated hepatitis C liver disease, and also supported with the telemedicine. And when the patients included in the correctional setting serving non-custodial sentences, this means that patients are in the community. They also attend prison facilities where also the screening is performed in this part with point of care test. we provided that this is feasible. We have high rates of screening, and most of the patients are treated, and effectiveness is also quite high, as maybe like the QMT. In the correctional setting, if you manage these patients, we have to say that modeling the impact of treating people in prison will reduce the incidence of the hepatitis in the community. And also we were able to review the databases of the Ministry of Internal Affairs regarding the screening rates. As you can see in the slide, we clearly have high screen rates in the prison, and since the treatment was widely available, the viremia problems was clearly declining. This is also possible in other settings, which are the people living with HIV, where treatments availability were quite wide, and also you can see that the incidence is clearly declining. This is regarding the model in different settings, but also we have the impact of hepatitis C management in this study that analyzes the admissions in a hospital in Catalonia. They showed that there's a clearly decline in people admitted in a hospital with a decompensated hepatitis C related liver disease, and they also developed a model of prediction that shows us that by 2025, less than 30%, than 3% of these patients will be admitted due to hepatitis C. Most of these patients admitted for the compensation has an hepatitis C active infection. We are still diagnosing this patient at a later stage disease. We have also data in a national level. People from the Ministry of Health has analyzed the admissions in hospitals in Spain, and they showed a clear decrease in hepatitis C related admissions with advanced and with not advanced liver disease. The region in the north of Spain, where I'm from, Cantabria, is the region with the best numbers, maybe related with as we were the first in releasing a regional policy to eliminate hepatitis C. The pandemic came, and I want you to see the pandemic as an opportunity to screen for hepatitis C, maybe when people is being tested for the infection, or which makes more sense when people is attending for a vaccination. And in Spain, we have an experience that also improves an screen policy for those admitted for a COVID disease, which makes all the sense, because these patients are prone to receive immunosuppressive drugs, and so you have to prevent hepatitis B reactivation, for example. So tests for those infections are mandatory. But there are still things to do, maybe because of the stigma of the disease that prevents people to come to health facilities. And there are several initiatives focused on increasing screening and linkage to care in those with high incidence of hepatitis C, like those men who have sex with men, people practicing chemsex, or those that are clearly with most incidents, like people using intravenous drugs and attending harm reduction programs. How can we do that? It's like moving the model of care where people is coming to hospital to a center, people-centered manner, making them easy to access treatment, and also diagnosis tests, I'll show you before, with a point of care test, for example. And also keep in mind that that's not only about hepatitis C, but also other diseases that are transmitted, that may be transmitted with the same risk. And we have technology like dry blood spots, and also tools that can analyze for all of them at the same time. So maybe now we have to see like hepatitis elimination as an opportunity to track the elimination, the control of other infectious disease. And this must be done taking in mind that we have to realize what we are doing at the national level, at the regional level, and also for a special population. We do not have a specific or reliable data regarding what are the numbers. The Ministry of Health regularly collects the numbers regarding the treatment, and by December 2020, almost 150,000 patients have been treated with high SBR rates over 95%, and this makes us one of the countries in the track for hepatitis C elimination by 2030. And finally, just to summarize my talk, I can say that most of the patients, at least that are already known with an active infection, are treated. In the prison, I think we've shown clearly data that our hepatitis is eradicated, but we need precise and integrated and reliable data to confirm elimination in our country to follow WHO recommendation after numbers. And keep in mind, if we want to eliminate hepatitis C, an effective hepatitis C vaccine is needed, but when it would be available in the future, also nice policies to make it available for all the people will be also needed. So going back to my first picture, I think hepatitis C elimination is feasible, must be sustainable. So thank you very much for your attention. I'm open to questions.